Hello everyone, we are medical students of Chulalongkorn University and today we are going to talk about one of the most important basic life support skill which is CPR or cardiopulmonary resuscitation. Firstly, we would like to introduce what is CPR. CPR is an emergency life-saving procedure performed when the heart stops beating. Keeping blood flow active extends the opportunity for a successful resuscitation once trained medical staff arrive on site. Also, CPR is not difficult to perform if we learn and practice this skill. Immediate CPR can triple or double chances of survival after cardiac arrest. Next, my friends are going to talk about each topics of CPR. The first one is impression of CPR when we see in many medias, television shows, or emergency news. The second one is CPR, which is a universal skill and is close to home. The third one is advantages of CPR in many situations. The fourth topic is CPR demonstration. The next one is question in doing CPR. And the last topic is pride when we do CPR and help others.
In your lifetime, you may have seen news about cardiopulmonary resuscitation in many occasions, whether it be someone has been back the other life by CPR or professional runner return to the track again after cardiac arrest. You may surely impressed by this news, but just you know how to perform CPR properly. In your lifetime, you might not be just a bystander, but a hero who bring back the other from the dead with your two hands. So let that sink in.
Okay, part two. CPR is universal skill. When talking about the resuscitation, people will come up with an idea that only doctor, nurse, or anyone working in medical field are involved in this process. In fact, everyone can be a hero. Everyone can learn and practice to resuscitate others who are in need. For example, person who have a cardiac arrest and out of the hospital area. Is very helpful since CPR would significantly increase person survival rate. So if you are interested in doing resuscitation, you can take the online course at this website to get a certificate for doing CPR. These classes give you the information and the skill you need to help during breathing and cardiac emergency. Or if you are in Bangkok, you can join the First Aid and Healthcare Training Center, a course about the basic first aid. This curriculum is for everyone who is interested in practicing resuscitation. Thank you.
The third topic is CPR is useful in many situations or benefits of CPR. CPR is a form of basic life support that is applied during a life-threatening emergency. Situations that call for CPR include cardiac arrest, which is electrical problem, drowning, suffocation, drug overdose, or any in which a person is not breathing. So here are warning signs that someone might need CPR. The first is chest pain, second, fainting, the third, breathlessness, the fourth, unconscious, and the last, unresponsive. Immediate CPR can increase chances of survival after the heart has stopped beating. The goal of performing CPR is to provide oxygen to the lung and to ensure the circulation of oxygenated blood to the brain.
So, let's talk about step-by-step CPR, guys. CPR is not that hard, but you have to do it the right way. Step 1. Check and shout. Are you okay? To ensure that the person needs help. Step 2. Call 911 or in Thailand we call 1669 for assistance. Step 3. Open the airway and check for breathing. Listen carefully for no more than 10 seconds for sound of breathing. If there is no sound of breathing, just press CPR. And step 4, place your hand at the center of the chest. Step 5. Push hard and fast, about twice per second, and use your body weight to help you administer compression. Step 6. Keep repeating the cycle of 30 chest pushes and 2 rescue breaths until the person exhibits signs of life, such as breathing.
Okay, let's move to the next topic. That is the caution of CPR. You should know that if you do CPR incorrectly, you can injure the victim. If you do CPR in the way that you were taught today, you can reduce the risk of the problem. However, some problems such as broken rib may be happen even if you do CPR in the right way. These are some possible problems in performing CPR. The first problem is wrong hand position for chest compression. The possible result is broken ribs or bruising or bleeding of liver, lung, or spleen. The second problem is bouncing chest compression that moves the rescuer hand off the center of breastbone. It makes ineffective compression and broken ribs. The next problem is compressing the chest too deeply. The possible result is it will injure the internal organ. The fourth problem is not compressing the breastbone deeply enough. That makes it decrease blood flow to the brain and vital organ, with the reduced chance that victim to survive. The last one is using breath volume that are too big, breathing too rapidly, or not having the airway opened completely. It makes the large amount of air in the victim's stomach. So it's very important to be careful every time you perform CPR.
Lastly, I want to encourage everyone to learn CPR procedures. Sudden cardiac arrest is a major cause of sudden death worldwide, also in Thailand. It can strike anyone, anywhere, and anytime. And when it does, the victim's survival depends on people around them. Learning CPR can help save one life, and also it can double or even triple a person's chance of survival. Imagine that one day you can use just two bare hands to save one life. That could be very amazing, and you will be proud of yourself. Not only doctor can help save other people's life, but everyone can do it. CPR not that hard. Don't afraid to push your two hands on the victim's chest. Thank you for your attention.